everyone, and Dr. Siddiqui here. Today I'm joined by Dr. Joshi, who is a clinical neurologist. Welcome.
Thank you.
So we're very excited to have you join us today. Before we dive in and discuss who you are and what you do, can you share an interesting experience that you had in the medical field, or that you've experienced in the hospital?
Yes, I have one experience that I always talk about and share with all the different places and different people wherever I go. So this happened when I was in intern year, and I was on a GI rotation, and one of the patient we were going to do a capsule endoscopy, a capsule camera that they swallow, and then have them watch their stool so that we can collect it later. And we gave normal instruction that it should come out in 4 to 5 hours. Luckily, that patient was very hyperactive in his bowel, so it came out in 2 hours. And instead of letting us know, he just washed it and swallowed it again. So that was one of the funny things that we didn't tell the patient, but he just did it on his own. And then basically we got a 2 whole recording of his GI tract twice the camera. So that's for him, but it's one of the funny things that it's really interesting.
All right, so let's talk about who you are and what you do.
So I'm a clinical neurologist. Actually, I'm also academic neurologist. I just started working for this brand new medical school in Southern California. It's called California University of Science and Medicine, and they just had their second year starting this August.
Mhm.
And I finished fellowship in June with neurophysiology, and I did the same residency at the same location at Harbor UCLA in Southern California as well. So it's been 2 months so far working as an independent physician at an academic institution, and also this institution has a collaboration with the county hospital. So it's a government hospital in Southern California, and it's been fun so far.
That's amazing. Great. So a couple of other things that we wanted to talk about is the challenges, in medicine, whether it's, trying to balance a work-life balance, or the things that you've gone through to come, you finish residency, you finish fellowship. So can you give us a little bit of insight into that?
Yeah, when we talk about training programs in the US, most people think that it's really hard, long hours. Fortunately, my program was pretty good in terms of work-life balance. I never felt stressed, even though I had those long 24-hour calls. It was well balanced, and throughout the year, so I never had any issues, and I was never really stressed at any point that I had to bring those issues to my supervisor or program director to address it. With that said, everybody is different, and everybody has a different level of stress in their life. And some people think that uh, whatever I have gone through in my schedule might not be best for the other people, and
Mm-hmm.
they will be stressed out even if they have to take one call. So it's different for different people. But so far, I would say my residency and fellowship experiences has been great, and I would I always recommend my program for neurology at least.
Absolutely. So can you tell us how long it has taken you, your entire training, and, starting from pre-med to medical school to residency to fellowship and finally being an attending. So give us a little recap of how long this process has been.
Right. So I think I finished when I was 33 with the fellowship. I started my community college at 18, and that's when I came to US. So I have my whole high school experience in foreign country, and when I came here, obviously I didn't know the whole high school system, education system. So it took me a while to figure out how the semester system works, uh, what are the majors and minors, and what are the things I have to do. So it took me, instead of 4 years, it took me 4.5 years to finish undergrad, which is not that bad. And also after finishing my undergrad, it took me another 1.5 years to figure out that I wanted to do something else besides just doing undergrad. So I was interested in healthcare. So I was looking into PA school and medical school, and eventually I applied for a medical school, and luckily I got accepted into one of the U.S. medical schools. After 1.5 years, I took MCAT about 2 or 3 times total because I wasn't that motivated in the beginning. So it took me 3 trials of MCAT, applied for med school twice, and then I got accepted finally. And after I got into med school, everything is very streamlined. I did not lose any years in between. Got the residency and fellowship right after.
Mm-hmm.
So from the day I started my med school, it's pretty much 4+4+5. So 5+4, total of 9 years.
Mm-hmm.
I started in 2010, so by 2019, just this year, I finished. But I lost some years, I would say a couple of years before I started my med school, and maybe about 6 months before I started my undergrad after finishing high school. So that was just to figure out what's going on with the US system.
Sure. Wow. So that's 4 years of pre-med, or 4.5 years of pre-med, 4 years of medical school, and was a 3 or 4 year residency?
4 years residency and
4 years residency.
1 year fellowship. So we are looking at nine. Uh, wow, I miscount. 4+4, 8+4, 12, so 13 years after high school.
15 years.
And
That's
and
quite
that
incredible.
that's just a straight education. And if you add a couple more years that I lost in between, that's another 15 years. I mean, total of 15 years.
That's incredible.
It takes a lot of dedication to stay on track. So.
It does. It truly does. You have to really be passionate about what you do and enjoy what you do to
Right.
continue to persevere and continue to try. I mean, having to take the MCAT just even once is daunting. It's such a scary test that, it challenges you. And then, going through and taking boards and continue, standardized exams, it takes a toll on you. But to persevere and to overcome those struggles, that's very admirable.
Yep.
So let's talk about some tips and advice that you would give for students and pre-med students that would like to pursue a career in your specialty, and you're a subspecialist. So what advice and tips would you share?
So for the med school, I think I heard it's getting more competitive nowadays since it's been 10 years now since I went to
Mm-hmm.
undergrad. So I would say nowadays most of the medical schools are requiring a lot of requirements, not just good grades, good MCAT, but a lot of extracurricular activities. And most of the med schools, they not only require extra activities, but they want you to do good in those activities. So if you're doing community services, they want you to do a well enough, like many more hours, um, rather than just doing few hours. So if you're interested in research, they want you to do some publication even before you enter med school, and not just work in a lab and do some bench work. So that's definitely more challenging for the undergrad students because uh, they they are already overstressed about in their undergrads to get good grades and also do other activities. And some people, they actually have to work to support their tuition and undergrad. So it has been a challenge. Most of the pre-meds are if they're lucky, they're able to finish everything in 4 years and then get into med school right away. But most people, I'm now, because of the added responsibilities that they have, it's adding 5 years or more to finish everything and before they successfully get into med school. So one recommendation I would say is out of all the activities that they do, the most important extracurricular activity is getting to know people of the medical school or the doctors and try to work with them because a letter of recommendation from the people, someone within the institution you wanted to get into, it goes a long way before anything else.
Mm-hmm.
So, for example, I'm in a medical school, and if somebody wants to work with me, and they get a letter of recommendation, and I'm also trying to get into admission committee as well. So just having my name there and people who are interviewing the applicant, they just see my name, there is also a increased chance that they will get into that school
Mm-hmm.
compared to someone who is completely from um, somewhere who had a lot of experience, but they may not have insider contacts. I think contacts in US in healthcare goes a long way.
Mm-hmm. Absolutely. I think that's excellent advice. So let's talk about our next question. Is there anything that you would have done differently in your education or your career?
I would, yeah, I one of the things that I have regretted is picking my undergraduate major, which is a pure science major, which has very little use if I have decided not to go for med school. So, for example, I have done biochemistry. If I have done just chemistry or if I have done biology, it's the same thing. It does not have, it will not give me a good job that pays me well. Instead, if I have done biochemical engineering or biomedical engineering, it definitely gives you boost of 20, 30,000 difference in the pay rate per year. So picking a good major to begin with, even though applicant or medical student or not a medical student, even if undergrad student is decided to go for a medical school and is a pre-med, I think picking a major that has more value is better than picking a major just because it's a requirement for medical school.
Mm-hmm.
So picking something that has, because things happen, people do change their career, and some people do decide to not go pursue medicine and they just stop after undergrad. At that point, it would be much helpful if they have done a valuable major that has a high demand in the market. So one of the things that I would have picked some engineering major if I have done it all over again.
Absolutely. Okay, so is there anything in medicine that you would like to see changed or that you would like to change?
Definitely increase more residency spots because that's where medical schools are opening at a much faster speed,
Mm-hmm.
and the residency spots are actually cutting down because of the increased requirement from ACGME,
Mm-hmm.
decreased funding from the Medicare CMS system. So, and because of that, we have shortage in the physician, and at the same time, there's way more advanced practitioner schools are opening up,
Mm-hmm.
and I think a lot of state legislatures are giving 100% independent practice to them, and I think it's not safe for the patient to be seen by someone who has very less experience. So one of the things is to increase funding for the residency spots so that more doctors will be available for the aging population we're going to have soon.
Absolutely. There's a lot more applicants than actual residency spots, and
Right.
it's becoming more and more difficult to get into residency. It's becoming competitive because we have MDs, DOs, and then international medical graduates as well as the Caribbean graduates that are all trying to come and, they're fighting for the same spot. So that's something that definitely would be a great thing to have
Yeah,
more.
and one of the bad thing is that, if, for example, if a medical student who is unable to achieve a residency, they are of no use completely. So please make the regulation or change the regulation in a way that they could be considered equivalent to NPs or PAs.
Mm-hmm.
So at least they can work under a physician.
Absolutely.
Yeah.
Yeah. So let's talk about neurology. What caused you to, pursue that field and then to do a fellowship?
Well, fellowship is more like a procedure fellowship, so it's just added my skills or increases my skills in on top of what I already practice. So um, I'm still practicing general neurologist, and one of the things that I like neurology is because I'm not a surgical person, so I hate ORs, so that removes all the surgical specialties. And medicine is very interesting, and in subspecialties, neurology is most interesting because it deals with the brain. It has so many disorders that we still don't understand. There's so many research going on, and medications are coming out in neurology at way faster speed as compared to any other subspecialties, as far as I notice. And there's still way more things to be done in this field, and it's just this is one area of the medical specialty that no one clearly knows why things some neurodegenerative disorders happens.
Mm-hmm.
So it is it is very interesting that I feel that it's, and it also has a good work and life balance. It's 9 to 5 since I'm an outpatient, and it also recently has the neurohospitalist has gained in popularity. So it's more like a 1 week off, 1 week on, and
Mm.
people really like that kind of job because they're just off half a month.
Yeah,
And
that's kind of nice.
Yes, and other thing is the teleneurology is another thing that I have seen people. They just live in Hawaii or Mexico or not even in the U.S., but
Yeah.
they just do this teleneurology running stroke codes in the U.S. So you are not limited to your geographic location. You could be working anywhere with this field. So there's so many different opportunities, uh, and you can make your own schedule. So it's work-wise, it's pretty good, and even as a medical specialty, it has very interesting disorders that I actually am particularly interested in.
Beautiful. So you kind of mentioned about teleneurology. So that was actually my next question, was to talk to you about telemedicine and specifically, specifically talking about telemedicine and neurology. Can you give us a little bit more insight in that?
Right. So teleneurology is not just inpatient anymore. There are people, for example, I know a VA or Veterans Affairs Hospital where one of the attending is doing teleneurology for the veterans clinic in a remote area where they don't have any veterans hospital.
Mm.
So they have this, basically they rented this small office space and they have MAs hired over there, and they just put the patient in front of the TV computer or the camera, and then this doctor can just do a exam remotely and just answers their questions and do the management, and blood tests can be done in the nearby location and stuff like that. So it's you can use teleneurology as an outpatient, as an inpatient. You can even do a tele-neurocritical care, though you cannot, you have to have an actual neurocritical care person there if they wanted to do some urgent intubation and stuff like that. But
Mhm.
for 90% of the neurologist job, it can be done remotely nowadays. So it just gives more freedom to all the doctors. And also it increases the the coverage that before nobody had. Like for example, in a small town, there's no neurologist. Now everyone has one because of teleneurology,
That's
and
amazing.
it's increasing. It's also telepsych is there, teleradiology is there. Um, I think even medicine, urgent care, there's so many doctors that are treating cough and cold, UTIs, and stuff like that. So
Mhm.
it's one of the things that I'm particularly interested in, and I have worked. I have seen clinic patient through teleneurology, and it was, I did not feel any difference.
That's amazing.
Yeah.
Well, any parting thoughts for our viewers?
Well, medicine is fun. Enjoy it. Just take it as a journey. Don't stop yourself from doing anything else or enjoying anything else just
Mhm.
because you're in a medical school. Uh, I, when I was, before I entered my med school, I was single. I got married. I had a kid during my med school and residency. I bought a couple houses, and I went to med school in Vegas. So every weekend after exam, we had a bunch of classmates who just booked the nightclub and they just enjoy. So I really enjoyed my med school and the whole journey of medicine. So I would say do not restrict yourself from enjoying your life because you only get one.
Absolutely. Well,
Yeah,
thank you so much, Dr. Joshi. It was an absolute pleasure talking to
yeah.
you and hearing all your advice and input about the neurological field.
Same here. Thank you.